Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us on the program this morning. There's a new first-of-its-kind treatment for managing sickle cell disease, especially the sickle cell pain crises that accompany the condition. Here now to explain what this new development means to patients are hematologist, oncologist, Dr. Darla Liles. She's with us from the oncology division at East Carolina University, and she's joined by patient Majara. Thank you both for joining us here on Health Professional Radio this morning.
Thank you.
Doctor, could you tell us about sickle cell disease and your experience working with people living with the disease?
Certainly. Sickle cell anemia is a genetic or inherited blood disorder in which the blood cells become sickle-shaped and then stick in the blood vessel wall. And this causes some very characteristic symptoms, including the most classic symptom, which is a pain crisis or veno-occlusive crisis. And so the physiology behind sickle cell is really that the blood cells are stickier and they cluster inside the blood vessel.
Who's at risk for getting sickle cell disease?
So sickle cell anemia is primarily seen in African Americans. There are other people that do have this disorder, but it's primarily in the African American community.
Majara, you've been living with sickle cell for a while now. Is that correct?
Yes, sir.
And what would you say are some of the biggest challenges that you and other people who are dealing with sickle cell face on a daily basis?
Well, Neil, I'll say my biggest challenges are living with sickle cell would be working, spending time with my loved ones.
Spending time with your loved ones is the biggest challenge?
Yes, sir.
Is it because of movement, because you don't feel like going out? What is it about the sickle cell that keeps you from seeing people?
The actual pain crisis that we go through, they are excruciating, very unpredictable. I could be fine during the day, lay down at night, get up with a pain crisis. I describe my pain crisis as being a dump truck actually sitting on my body.
Now, is this something that you've been experiencing as long as you can remember? Is it something that developed later on in your disease?
Oh, no. I was first diagnosed at 13 months old, and I'm now 34. So, yeah, all my life.
When these episodes occur, what do you normally do? What's the normal treatment?
Well, I first get in contact with my doctor here. I have to be admitted in the hospital. I'm treated with pain medication and plenty of IV fluid. Doctor,
what is this latest development? Is that specific to Majara's case as far as treatment for these episodes?
So the reason we're here today is because the Food and Drug Administration has just approved a new therapy for sickle cell disease. The medication is called Adakveo, and it has been shown in clinical studies to reduce the number of painful crises in patients just like Majara. In fact, Majara was actually on this particular study. This medicine is not a pain medication as we have typically used for sickle cell pain crisis, and the medication was given intravenously monthly for 12 months. The side effects with this medication were fairly common things like nausea, back pain, and fever. And while this medication is not for everyone, it actually did improve the number of painful crises in this group of patients that were on this clinical trial. So for patients who might be interested in this, they should speak to their doctor about if this is an appropriate therapy for them.
Now, you say it's not a pain medication as you've been traditionally using. Is it non-opioid based? Is that
it is not opioid based. Mm-hmm. Yeah, it is. It actually attacks the physiology of the sickle cell disease by reducing the stickiness of blood cells in the blood vessels. So it actually is not a pain medicine.
How long acting is this? I mean, Majara was talking about up to 5 a day. Does it deal with the symptoms of the current episode, or does it tend to alleviate coming episodes effectively?
On this clinical trial, the patients were given the medication as an intravenous infusion once a month for 12 months. And during that 12-month period, patients were noted to have a reduction in the number of painful crises.
And as far as the age of these patients,
actually, this study was for patients that were 16 or over.
In the past, what had been the treatment other than pain medications and the fluids? Was there anything else other than that?
Yeah, so this is not a replacement for any treatments. This is in addition to other treatments. So for physicians that might want to hear more about this, you can actually visit Adakveo.com for the full prescribing information.
By Novartis?
Yes, it is.
Well, I thank you both, Doctor and Majara, for joining us here on Health Professional Radio this morning. Thank you both.
Thank you.